There's three different things that people will typically ask me about with rhinoplasty. One thing that brings them in is if they have a hump on the bridge of their nose, and somebody has a big dorsal hump. That usually is the most common. Secondly is a big bulbous tip, a big full tip to the nose. Brings people in. And then the other thing is when the nose is just out of proportion to the size of someone's face. When I operate on people, they're typically at a transition in life, and usually the age distribution is high school graduates or college graduates, or someone who is in like the 20 to 30, maybe changing a job, changing a location. Men, for example, their jaw will grow until they're about 21 or 22, so you don't want to make a nose too small on someone who's still growing. I usually will ask young women if they've changed their shoe size recently, and if they haven't changed their shoe size in a couple of years, they're probably done growing and are safe to go on with that kind of surgery. I like to show pictures of my patients pre and post-op to prospective patients, just so they can see through my eye what I'm trying to achieve. What are the aesthetic goals? What's a feminine nose? What's a masculine nose? Feminine nose should have a bridge that projects less than the tip of the nose. So the tip projects slightly beyond the bridge. Okay, a male typically has a very straight nose. I tend not to be an engineer with it and don't put them on graph paper and things like that, but I do take into account proportions in the face and what's aesthetically pleasing. And really that's what we're doing, is we're softening their features. Still going to be their nose, but it's going to be maybe toned down or maybe corrected, but it's still going to be their nose, and we're not going to change their entire appearance.